Welcome to InConversation, folks. We come to you from Washington, D.C. My name is Ramesh Patani.
And I'm Anisha Abraham.
And folks, Anisha is a physician, and the debate that's raging on in Washington, D.C. is health services. And Anisha, my question to you is, what do physicians think of Max Baucus' plan?
Well, that's certainly an interesting question, and Max Baucus' plan was very recently revealed. I think that there's one issue that physicians are concerned about. Well, there's several, but at least one that physicians are concerned about, and that has to do with the fact that there aren't significant caps on malpractice. And for those of you that haven't been following this, again, malpractice costs have really been soaring, and that's, again, the costs that have to do with insurance and certainly claims, and if a physician were actually to go to court, all of the costs that are associated. And we know that currently there are very high rates that are associated, and there's even studies that suggest that when there's very high malpractice rates, physicians actually will practice in defensive ways, which also increases the cost of health care and certainly has a significant effect in terms of health care costs in general when there is malpractice insurance. So that's one of the concerns, again, that physicians have.
That's very true. You know, I have noticed whenever you're legally threatened, folks, you write very few emails, you write very few words to protect yourself, and then you use a lot of defense medicine, which means take a lot of tests. And it all is so messed up is because of this white elephant in the room, which is called malpractice insurance. Someone needs to look at it. So you're right, that is a biggest threat to the physicians.
There's a couple other things that I've been following that I think are actually quite revolutionary as we talk about healthcare reform, and I know this concept, again, is really revolving. But one in particular is a suggestion by a group of doctors and policymakers, and their idea is to actually tax sugary beverages as a way to actually increase revenue when it comes to, again, healthcare reform. And what they're saying is that this would be a very powerful weapon to actually curb obesity by taxing sugary drinks, akin to, again, taxing cigarettes and smoking products to decrease people from actually smoking. And the beverages that they're talking about include things like sodas, include juices, energy drinks, and even iced tea. So there's quite a few sugary drinks that they're actually including in this. And this is in light of the time where they're now removing vending machines from schools, for example, because they're worried about, again, the link between sugary beverages and obesity. And there's a very direct link, and there certainly have been a lot of concerns.
You know, the government does levy taxes on gasoline,
right,
so that you don't use too much of it. And you're right, same way they can put tax on fat and sugar and
right,
get the same results.
Well, advocates say that, again, Medicaid and Medicare are public funds, and so there is a lot of real reason to actually cause a tax to decrease obesity because, again, patients that are obese increase healthcare costs. So by decreasing their consumption, that they will actually perhaps improve the likelihood of decreasing obesity. And I think there's a lot to be said about this plan. I think it's killing two birds in one stone. You're increasing and actually maybe funding healthcare reform, but you're also decreasing the likelihood of obesity, which is a real issue and certainly one I see in my pediatric and adolescent population.
Well, folks, this is the biggest issue that you're going to come across for the next few years of your life. Take a look at it. Make sure you call your congressmen and senators, and whichever way you want it, make sure they know. Right?
You know, Ramesh, as we're talking about this, I have one other idea that I wanted to bring forward.
Sure.
And this is the concept of actually having more physician FaceTime. So imagine if you went to your doctor's office and you actually had no wait time. You spoke to your doctor for 30 minutes. You were able to talk about all the questions you've ever had about a particular issue or concern. And that doctor was able to follow up with you later on and maybe chat with you on the phone or send you an email just to kind of talk a little bit more about that. Well, is that a fantasy? Not if, again, we can increase the amount of time that physicians can spend with their patients. And that's certainly another proposal as we talk about healthcare reform.
Yeah.
And they had a study which actually showed that if physicians cut down on their patient loads and went from, say, 2,300 patients per year to 1,800 patients and increased their visit time with a patient from 15 minutes to 30 minutes, it actually cut back significantly on ER visits, which is a huge cost saver, and it really increased various measures of quality of care and patient and physician satisfaction. So I think there's a lot to be said for this, and I certainly think, again, in my own practice, when I have more time to talk to my patients, I feel better about it, my patients feel better about it, decreases the amount of times they come back in for follow-up visits, again, decreases the times that they have to go in for emergency visits to other places, which costs 10 times the amount of what it costs to go to primary care.
You know, that's so true. But the model of HMOs is they cram 1,000 or 2,000 patients on you, and they just pay you only $7 per visit. So consequently, you have to see so many people. So it's the policy of the HMOs. And while the government's at it, they can change that too.
Right. So part of the challenge with this is, would the reimbursements be the same if they saw less patients? And also, how are you going to have enough physicians then to see all of those patients that really need visits? And will that increase the amount of wait time that you actually need to have to even make an appointment in the first place? And they've looked to places like Sweden for the model where physicians actually only see the most sick and complicated patients, and they use a lot of allied health professionals like nurse practitioners and physical therapists and so on to see the patients that are less acute. And that way they kind of disperse medical care, but they still are able to have quality time with their patients.
You know, folks, President Obama last week, he went on 5 different TV channels and gave the interview 15 minutes to each one of them. And he's pushing for his healthcare plan with the public option. And also he's talking about Afghanistan. You know, a report came out last week in which a general in Afghanistan said, if we don't get more troops, we're done, we're finished. You know, from last few weeks I've been talking about it. It is no longer necessary for the United States of America to be physically present in any war. They need to get out of Afghanistan. They need to get out of Korea, Okinawa, Germany, and all the other locations, because today cyberspace is the next frontier. I was reading Wired magazine, and it says dangerous ideas ahead. And I love dangerous idea. One of the ideas in this is we've been playing defense. Chinese, Russians, and the others are trying to attack our computers, and all we are trying to do is play defense. Well, we don't need to do that anymore. This Navy admiral says, let us make cyberspace the next frontier for all wars. For all wars, because if you can dismantle the communication model of the warring faction, well, you would have actually demolished their intent to fight. Because if they can't talk to their people, done. He's promoting there's time for America to become the biggest cyber cop. You know, get together with all the internet companies and make sure that you have a control over it. You should be able to get into Iran